All right, everybody. Thank you so much for joining us tonight. We love when you guys take time out of your busy schedule to join us to learn all about health and how you guys can live a healthier lifestyle and get your families healthier. Because I don't know about you, but the healthier I feel, just the happier I am. When you don't feel good, you're just not happy. So we are going to start. I want to talk. I'm going to be talking, and then Renee is going to be sharing as well. And we have a couple of special guests at the end. And my name is Karen Orlosky. I live in Cumming, Georgia, which is north of Atlanta. And I lived in Virginia, and then I was 26 years in Fort Lauderdale as well. And now I'm in Georgia, and I absolutely love it. So I have been a part of this community for, you're going to be learning about Juice Plus. I'll be sharing my short story. I've been taking Juice Plus for 21 and a half years, a little over 21 years, and sharing with people to help them get healthier for, gosh, it's almost 20 years, which is unbelievable to me. And I can't imagine doing anything else. I did newspaper before this, and I'm so glad I got out of that. So anyway, let's go ahead and get started. We want to respect everybody's time. We're going to be talking about one simple change. And the one simple change that I started 21 and a half years ago that I didn't know was going to make such a difference in my health was Juice Plus. I thought it was just a different vitamin my friend was recommending to me, and that started me on the trajectory of just better health and nutrition. And I'll tell you a little bit about that story in a little bit, but I'm so much healthier now at 57 than I was at 17 and at 27 and 37, so it's been great. So we're going to talk about one simple change. We're going to talk about how, Juice Plus was my first simple change, and then it led to other simple changes. And that's what we want you to think about tonight as you're watching that presentation is what simple changes can you make? We don't want you to leave this and think, oh my gosh, that was so overwhelming. I don't even know where to start. We want you to think of this as one simple change. You can uh, you know, add in something good, whether it's sleeping better, drinking more water, or taking something out of your lifestyle that isn't feeding your health um, for the better. So anyway, okay, let's go to the next slide. Are you able to move it, Renee? I can't hear you.
I'm sorry. Let me do that. I'm sharing the screen. Do you see the screen?
I see the screen, but yeah, but you need to move it. I can't move it.
Right. Okay. I just want to make sure. Is this the right slide that you want?
No, I need the next one. I've been talking about that one.
You tell me if we need to move.
Yeah.
Oh, okay.
Yep. It's still on the same slide. Is it not moving?
It's moving on my end. I'm going to stop.
It's not moving for me. Does anybody else see it moving?
It's not.
Not
No.
Okay.
No.
Let me stop sharing and let's do this again.
Yeah. That's why I'm confused. I'm like, it's just still on the same slide. So if you guys, while we're waiting, because we love technology, when it works well, it's well. And when it doesn't, it's not good.
Are you seeing the slide now?
Yeah, now I can see it moving.
Okay.
Yeah.
All right.
There we go. But if you guys want to in the chat, put what kind of, what would be a simple change that you could make this month in the month of October. So I love when you guys share that stuff. Okay, so let's talk about good health. What does it mean to you? Healthier eating. Everybody's got a different definition of good health. Healthier eating, sleeping better, drinking more water, exercising. It could be less stress. It can be getting together with community because I think when you have relationships and build community, then that's good. One simple change, I talked a little bit about this. What one simple change can you make in your life that's going to be good? If you think about making a change a month, at the end of the year, you have 12 changes. You've either added in something good or you've eliminated something that isn't fueling your health. And so when you think of it like that, because, I've always heard that a to make something a habit, it takes 30 days. It's really the consistency of it. So, one of the very first changes I made was I eliminated soda. And I thought, okay, if I can do that for 30 days, then, the next month I could make a different one simple change. So, okay. So we know that eating a diet rich in fruits and vegetables is important to health. Nobody here is shocked by that information, right? Nobody is shocked by that information. So, what a lot of people don't realize is that the nutrition in our produce is really lacking compared to what it used to be. So it used to be that the recommendation by the USDA was 5 to 9 servings. Does anybody remember that? I might be just
Mhm.
old, but 5 to 9 servings. It is now 7 for children, 9 for women, and 13 for men. And if anybody else feels overwhelmed by that number, welcome to the club, because there's some days I crush it. Actually, today I did pretty good. But you know why I did pretty good? Because I was at home. I stayed at home all day long. Usually I have a busy schedule. I'm out running around, and it's just really hard to get that in. So there's a lot of times I'm not ready. Hold on just one second.
Sorry.
Um, there's a lot of times where we are we're not getting enough fruits and vegetables in. And there's three reasons. There's three main reasons. It's we don't like them, which that's my husband. My husband doesn't like most fruits and vegetables. They are getting expensive. I mean, anybody else take a look at, I bought 3 apples the other day and it was like $8. And
Mm.
then we're busy. We lead busy lives. So a lot of times we're going to a fast food, we're going to restaurants. If we can pack fruits and vegetables in a cooler next to us, and then that's what we snack on, pack some fruits and veggies, pack a salad to take with us, pack a meal that's already done, then that's a great step. Okay. So we just talked about we don't eat enough fruits and vegetables. And the downfall of that is we're not feeding our body. Fruits and vegetables give us the polyphenols, give us the fiber that are the prebiotics to feed our microbiome. I would love one of these days I'm going to do a Zoom just on like gut health because it is so, so important. Your gut is related to your immune system, your brain, your skin, I mean, just everything. So eating fruits and vegetables is crucial, and we need a variety of them. We need to eat the rainbow. So nature cannot be duplicated. I mean, for years and years and years, I took a multivitamin. And if you listen to the doctors or you watch TV, you think that a multivitamin is, replacing fruits and vegetables. I ask a lot of people, I do a lot of coaching, and, I ask people, why do they take a multivitamin? And they're like, well, because my doctor told me to, or because I'm not eating right. So people know they're not eating right. And I don't think people really think that multivitamins are filling the gap, but they don't know what else to do. So multivitamins, there's only 13 known vitamins, but there are hundreds of thousands of phytonutrients, okay, plant nutrients. So an apple has 10,000 ingredients. I've heard broccoli has 13,000 ingredients. I've heard blueberries, which are at the close to the top, have close to 20,000 phytonutrients. So when you compare that to, an average multivitamin, which maybe has 20 or 30 ingredients, you're missing not only all of those phytonutrients, but you're missing the synergy of the fruits and the vegetables. So an orange doesn't just have vitamin C, it has thousands of other phytonutrients that they are working in synergy, like an orchestra, to work inside your body. And that's what makes it bioavailable. So let's talk about the first simple change that I started with, and it was the Juice Plus capsules. So I did not understand why these were different. I'm a little embarrassed to admit it now, but in the beginning, I didn't really understand how this was different than a multivitamin. Um, my adoptive mom was a nurse, so it was all about treatment. My biological mom had all kinds of health issues. Clearly, I'm adopted. And so when I started exhibiting allergies and asthma and migraines and digestive issues, I mean, I was on prescription meds for all of that. I was getting allergy shots twice a week. I had ear infections several times a year, so I was on antibiotics. So no wonder my gut was always messed up. I mean, I just was really sick. And I was always on vitamins. We had a bathroom closet full of medicine from that it looked like a CVS. So if I had a stomach ache, I took Pepto-Bismol, right? If you had something, you took, something else. So it was all about the medicine. It was all about treatment. Nobody took a look at what I was eating. And so I'm so glad that I know better now, but it wasn't until I got pregnant with my son that my best friend introduced me to Juice Plus and really went into, and that's why we love to do these presentations, because we really want to stress to you that the nutrition inside Juice Plus is like a salad bar. So picture a salad bar in a capsule. It is not just vitamin C, vitamin A, vitamin D. It is the kale, the broccoli, the cabbage, the oranges, the apples. Okay, you're getting all of that nutrition, a salad bar in a capsule and in a gummy. And so it works so differently in your body. It's bioavailable. Renee's going to talk a little bit about the research later. But you can see that they're plant-based, they're vegan, they're gluten-free, and those gummies are stinking delicious. I use them as a treat when I have a sweet tooth. Okay, bridging the gap. I want you guys to take a look at this picture, okay? From left to right, you have the fruit, which is the red. That's 10 different fruit, 10 different veggies, 10 different berries, and we have a plant-based omega. So Juice Plus is different again because it is whole food nutrition. It's not isolated synthetic vitamins made in a lab by some guy named Bob. Okay, these are, farmers, and Renee is going to talk about that grow these fruits and vegetables. So imagine trying to go to the grocery store and purchasing all of those and eating those every single day. There's no way. I did pretty good today, but there's no way I could get that variety in. Imagine the expense. And imagine, I know for me, I get busy. They're going to go bad in your refrigerator and on your counter before you even have a chance to eat them. So, but I love that I can get nutrition while I eat a lot of these often. I don't eat beets often enough. There's a lot of them in here that I don't eat often enough, and I love that I can get that nutrition. Cranberries. When do I get cranberries? I get cranberries at Thanksgiving and Christmas. Like that's the only time I eat cranberries. So, and then the omegas, we're going to talk about the plant-based omegas a little bit later, but those are fantastic because most of you guys are probably already thinking fish oil. So I'm going to finish my quick story that I was talking about with the allergies and the asthma and let you know that 21 and a half years later, I felt a difference within the first 10 months. And it has been 21 and a half years since I've been on any of that medication for allergies and asthma. I have not been on antibiotics in 21 and a half years. It's not that I don't get sick, but I do not get sick like I used to get sick. I used to get sick for 2 weeks at a time. Now I can feel when I'm starting to go, get a little bit sick. And I call it my Juice Plus hazing. I take Juice Plus actually 2 to 3 times a day. I make sure there's no sugar in the diet. I'm flooding my body with water. I'm doing veggie soups. And guys, I'm sick for maybe a day, maybe 2 days. So it's, I love that now I know how to feed my body to stay healthier. Yeah. So, okay, go ahead.
Sorry. So this is one of my favorite parts about Juice Plus is talking about the farm fresh nutrition. So Juice Plus is a company that is committed to providing you and your family with quality nutrition. And they do this in two ways. Primarily, they have generational contracts with the farmers. They know these individuals, they have relationships with them that are longstanding. And the farmers grow specific produce, so therefore they become experts. They know the plant, they know how it acts, they know what it looks like when it actually reaches its peak of ripeness, which we know to be the time when it is fullest with the most nutrition available. They also work for one client, and that's Juice Plus. So not only do we have the generational contracts and their experienced farmers, but Juice Plus also tests every product to ensure the natural purity of it. Let me go through here next. The clinical research also backs up the Juice Plus products to do what they say that it will do. Thousands of health professionals recommend Juice Plus to their patients. Why? because it's been tested and researched at prestigious institutions and universities such as Yale and MD Anderson. And then their findings are published in medical journals. That's where physicians go to look for the information on the products that they want to recommend. On a brief side note, my husband, 7 years ago, and I both started on Juice Plus. And one of the things that really drew me to Juice Plus was the research. He had been on blood pressure medication for over 20 years and still had elevated blood pressure. He also was diagnosed with 3 autoimmune diseases right at the beginning of COVID. And so we started Juice Plus in May. 6 weeks later, he had a follow-up with his primary care physician, and his blood pressure was now within normal limits. And today he is off blood pressure medication. And that to me is a huge blessing. The second part of that is that we followed up 9 months later after starting Juice Plus for his 1 year follow-up with his rheumatologist who had diagnosed him with these autoimmune diseases. And his blood work showed no evidence of those autoimmune diseases. So to me, that was a huge gift. But yet there's a little bit more to go ahead and share with the story. The reason that the physicians, the medical professionals are wanting to go ahead and prescribe this medication, this product to their patients is because the fact that it is reviewed. It's ethically conducted, double-blind, randomized testing on humans taking their product. So what this research does is it backs up in Juice Plus to say that what Juice Plus says it can do, it can do. In addition, there's always more from Juice Plus, right? Everything that Juice Plus does is done with excellence. And so hold on to your heartstrings here as we get ready to listen to Karen share a little bit more about some additional products. Juice Plus is always on the cutting edge, looking for things that will help us to support better nutrition. So Karen, do you want to talk to us about the superfoods?
Yes. So the superfood I didn't know was the product I was missing because I have no problems taking capsules. So I've been taking the capsules for the 21 and a half years. And we came out with this past March. And I was like, oh, I don't know. This is, guys, the fruit, veggie, and berry powders in a stick that you can just dump in with water. And some of you guys may have seen, this is my water bottle. So talk about drinking more water. I use a half-gallon water bottle, and I actually dump that stick into my water bottle, and I drink that all day long. Sometimes I drink it faster than other times. And I love that because I know that I'm getting that nutrition into my body with the water. And then I also put it into my smoothie as well. And I'll talk a little bit about that. But you can see this actually, if anybody does intermittent fasting, this does not break an intermittent fasting. There is 1 gram of sugar. It's vegan, it's gluten-free. There's no, it's non-genetically modified. So, certified kosher. It is, picture the capsules, but put into this powder stick. So anybody who has capsule fatigue and they're looking for something different, this is the answer. And it is delicious. It kind of has like a berry blast flavor. Okay, super biome. Oh my gosh. So I don't know about you guys, but a lot of people have gut issues. I was just looking up the other day, and that says 70% of people have digestive issues, intermittently, and 40% have them every single day. That's a lot of people having digestive issues and gut issues. And when I say gut issues, it doesn't necessarily mean, oh my gosh, I'm constipated or oh, I have gas. If you have microbiome issues, it could be you have eczema, you can have allergies, you have brain fog, you have a poor immune system because your gut is responsible for so many things. Well, Juice Plus, the capsules and the superfood and the gummies, that has research showing that it helps the microbiome, that it actually increases the fecal butyrate, which is a short chain fatty acid to help feed the probiotics and increase, okay, our microbiome health. But a lot of people need gut health fast, and this is what this is for. This is kind of the accelerated gut health product, and it is a prebiotic, a probiotic combo. And I think a lot of people don't know what prebiotics are. It is the fiber. So the fruits and vegetables, like I said in the beginning, are the fiber. It's the prebiotics that feed the probiotics to make the postbiotics to keep your gut healthy. And it is so necessary. The probiotics with Juice Plus, I had never heard this. I've taken probiotics on and off for years. And ours are encapsulated in such that it will make it past the stomach acids instead of being just, eaten up and dissolved. It actually makes it through to make it to the small colon, okay, the digestive system, which is where it needs to be to help heal, okay, and to help your gut. So the prebiotic and the probiotic. And I will tell you, I felt a difference taking this product. I have a prebiotic through Dr. William Boltzowitz. I don't know if any of you guys know him. He has one um, through his thing, and it is expensive. Okay, it's $80 a month for his. And I did not feel a difference when I took his. I actually felt a difference. My stomach was a little rumbly. I had some excess gas. But then I was like, oh my gosh, this means this is working. Like my gut is like, okay, thank you very much. And that was just for a couple of days, and it has been awesome. I have had no bloating. I'm sleeping better because guess what? Your gut health, your microbiome is responsible for 400 times more melatonin than your brain. So if you're not sleeping well, it could be a gut health issue. There's so many things that it could be responsible for. So I am super excited, if you can't tell, about this product in addition to the Juice Plus. Okay, I'll try to calm down. Okay, another of my favorites. So Luminate, I call this is my no more squirrel because I would walk around the house and there's always so much to do, okay, because I work from home, so I'm always finding stuff to do and I could start to feed the dogs and then I look up and I'm like, "Oh my gosh, I forgot to feed the bird." And the bird's right next to some plants and oh, I forgot to water the plants. And then all of a sudden I've started 8 different things and finished none of them. And so and we all, especially as we get older, because I know I mentioned that I'm 57. So, we all need a little bit more brain health. People, I think, are very aware and nervous about getting Alzheimer's and dementia and all of those. Well, this has fantastic ingredients that we all have heard about. Ashwagandha, lion's mane mushroom, cordyceps mushroom, Alpinia galanga. There's sage, there's rhodiola. I had never heard of some of those, but there's also coffee berry. I am not a coffee drinker. I just don't like the taste. There is a big difference between the coffee berry, which is the whole fruit, and just roasted coffee beans. So coffee berry not only gives you some natural caffeine, 80 milligrams, that does help, and with the ashwagandha gives you more of a sustained energy throughout the day. But it also gives you all the polyphenols and all the phytonutrients from that berry for brain health, which is amazing. So I love this. I take this in the morning before I go to the gym because I need all the help I can get when I go to the gym, that's for sure. Did you want to do the complete shakes, Renee?
Sure. So the complete shakes again are part of my regular routine, and I love them for many reasons, primarily because they taste good, right? They also have protein in them, 13 and 14 grams of protein, but they also come with the fiber. So they're glycemically sensitive. If you have anybody who is sensitive to sugar, these protein shakes will actually counterbalance that and allow them to enjoy this protein shake. There is a little bit of sugar in it, but the fiber works collaboratively with that to keep a low glycemic index. But I also enjoy these because not only do I enjoy them with the shake, like Karen has shared with us before, she puts a lot of stuff in her shake, makes it taste just as good. But sometimes I just enjoy the sachets here are really easy if you're traveling a lot, which I do, to throw into your suitcase, your backpack, your purse, whatever, and on the go with a shaker bottle, you add some water, shake it up. It is absolutely delicious. And we know if it tastes good, then we're going to drink it. Karen, you love to perform.
Yeah, well, I love both of them. And I am a girl, if you guys know me, I get FOMO. Okay, I hate missing out on anything. And so the complete shake, well, I love that because there is some prebiotics and probiotics in that. And that is formulated to be a meal replacement. So it's got the fiber, the carbs, the, protein, all of that. Perform is different. Perform is for extra plant-based protein. So there's 25 grams of protein in a serving with this one, but it is also for really after performance. So it is for help with muscle recovery, muscle growth, um, oh my goodness, bone health, energy, all different kinds of things for really like after a workout. And so my typical shake, Renee and I met on Zoom this morning, and what I was drinking after my workout was I do berries. I had in there some pineapple. I had some frozen cherries. I had an orange. I throw a lot of stuff in there. I had 1 scoop of the vanilla, and I had 1.5 scoops, almost 2 scoops of the Perform. And then I threw a superfood powder in there and blended it all up, and it is amazing. And I get all of that nutrition, all of the different nutrition in one. So I just love that. And then, both of these shakes have soy, non-genetically modified soy. And if anybody has a question about that, we're happy to answer that and also send you resources. I was actually a part of a study with menopause and getting rid of hot flashes and other menopause symptoms. Use in soy was one of the ingredients you included. It can help reduce breast cancer. There's so many benefits for soy. It is the genetically modified, all of the fake soy in the products. You just have to be very careful of which soy you are eating. And the soy that we use is the same as like edamame, tofu, like that. You do not want to use the genetically modified.
And here's what my heartstrings get pulled on when I learned about Juice Plus. And one of the things that I found that was just phenomenal about this company, they live behind their motto, inspiring healthy living. Not only for the people who can actually subscribe and pay for the product, but they also want your children, my children, your children, our nieces and nephews, our godchildren to actually be healthy as well. And so what they do is they allow with every adult order for you to sponsor a child at no cost. That's free. The child will get the fruits and vegetables, whether they want the gummies or whether they would like the capsules. No other company I know does that. And they will sponsor that child from the age of 4 all the way through their 25th year of life. I have 5 grandchildren ranging in ages from 18 down to toddlers, and they are all taking Juice Plus, and they like it. And I like it because it's bridging the gap between what they eat each day and what their body really requires. Here's just some quick, a snapshot of the outcomes of healthy starts, what we call healthy starts, which is the Juice Plus program for children. 71% start consuming less fast food. They're missing fewer days in school, which means if I'm a working mom outside of the home, I would end up taking time off to take my children to the doctor, which is costly. I'm going to lose out on the work day and stay at home to take care of my child. They're also taking fewer over-the-counter medications. And so we want our children healthy, right? Nobody has time to be sick. We want our children healthy, and we want to inspire healthy living for them as well. So we have a few friends that have joined us tonight, and we would like to hear their story and their experience with Juice Plus. Kelly, I believe you're on the call. If you would like to come off mute and take a moment to share your story, we would love to hear from you.
Sure. Hello, thanks for having me. I am a breast cancer thriver, and I was going to Mayo Clinic. And as I went through treatment, I removed all the other vitamins and supplements and everything that I was taking, and I was nourishing my gut and side effects through my gut with real food. Everything was going good until they put me on a different drug last year, and it wreaked havoc. It's called Nerlinks. It is horrible for your gut. I have a spare pair of underwear with me at all times, just in case. It's that evasive of a drug. And you can ask Melissa, I don't always go to events. So I started eating more sourdough. Who doesn't want to eat more bread and pasta all the time, right? Amazing. Yeah, I'm not getting any fruits and vegetables. So I called up Melissa and I'm like, all right, tell me how this is not a supplement, because I don't want supplements. Tell me how it's different. Within 2 weeks, I had another visit at Mayo. My liver function was normal. And that from all the chemo, from everything, like it was a struggle. It was a struggle to get up to even close to normal. And within 2 weeks on the capsules, I'm normal. Now I pop the gummies because they're my treat in the afternoon. Yeah, so in the morning with my big lunch meal, and I take my pills of Nerlinks, hear my stomach start grumbling, and in the afternoon I take my gummies, and it helps. It definitely helps. So I only have 3 more months on those pills, but if you have anybody going through treatment or going through the cancer journey, your side effect health is in your gut.
Mm-hmm.
and you can control your side effects by controlling your gut health.
That's amazing. And I'll tell you what's amazing is you just kind of trusted Melissa. You know what I mean? Like, I don't even know if this is going to help, but I'm going to try it. And
I have heard whispers of it before, but I'll be honest, as a health coach and a real food person, I poo-pooed the gummies. I'm like, why do I need gummy vitamins? Because that's how it was shown to me 10 years ago by a well-respected peer. But then I circle back and I'm like, all right, I respect Melissa too. Known her since I was 12.
oh,
She's a smart cookie. Let me see what she has to say. So yeah.
I love that. Oh my gosh. Well, and this is why we share, right? Stories like this, one person at a time. It's amazing.
Thanks.
Okay, Debbie.
Hi, everyone. I'm Debbie DeJesse, coming to you from Palm Beach County in Florida, and thank you for having me tonight. I have so many stories, but I'm going to narrow it down. I'm a healthcare professional. I worked in the ER for years. I was one of those medically trained medical models, treatment-based, just like Karen was talking about. So that I look at as the reactive side of things. After I became a patient, I decided I would start looking at the proactive side of things, because your life changes when you're looking at it through different lenses, and I didn't want to be on a bunch of pharmaceuticals. But tonight I want to share about my husband. He had surgery on the 10th of this month, a couple weeks ago, on his gut, and they had him stop everything. Now, he's been on Juice Plus capsules for 8 years now, and had a previous medical journey. And this is stuff that we found, thankfully, as a surprise doing screening tests. But he was at Moffitt Cancer Center the 10th of this month and had surgery on his pancreas. And they said, you're going to be on a liquid diet. You're going to this, you're going to that, you're going to have all these side effects. I have to tell you, he's on a regular diet right now. The only thing that we're keeping out of his diet are the raw fruits and vegetables because they're a little harder to digest. But he is taking his capsules as regular. He has started on the prebiotics and the probiotics, and he is up. He's almost healed completely. He's walking, he's driving, he's eating. He ate a pastrami sandwich the other day. And I just can't even begin to tell you what a blessing it is to heal so well. As we were leaving the hospital, of course, I stayed with him. The nutritionist came in to speak to us, and she said, we want to give you shakes to go home to support his healing so that he gets enough protein, because his body's going to need that, and he's not going to really be able to eat much. And I looked at her shakes and I said, all due respect. Now, in the past, I would have just shook my head and said yes, and then fed him what I was going to feed him. But this time I decided that I would be bold, and I said, all due respect, I appreciate your knowledge base and where you're coming from, but I prefer our shakes. And she said, may I look at them? So I had the sachet packs because I don't go anywhere without my Juice Plus stuff. And I showed it to her and she said, wow, this stuff is, she looked at all the ingredients. She said, this has better ingredients than what I was going to send you home with. That's amazing. So again, justification from the medical community as well as my own personal experience. I won't go without these products. And every time they come out with a new one, it just adds to the health journey, and it's better and better. So thank you.
Yeah. And that's so perfectly said. I mean, they come out with new products and it's something different to help the overall health, you know?
Right.
And as much as I've learned about gut health, I was super excited when they came out with Super Biome. So I just want to thank everybody. And I'll talk about, I was a little self-conscious, I'm not going to lie. So on the 10th of this month, the same day that Debbie's husband went in, I went in for it was medically necessary, even though it was more of a cosmetic thing for me. I went in to have the eyelid surgery because because I could. Really. We've had a lot of medical stuff this year. I met my deductible with other things, and I was like, I'm having this done. And I have other friends who have had this done, and they cannot believe how fast I am healing. Like the bruising, all of it. And honestly, I mean, we're like, I don't even know what today is. This is 12 days in. I mean, and he's like, oh no, you're gonna be, black and blue and the whole thing. And I'm not saying it's perfect, but I'm pretty darn happy with how fast I'm healing. So, yeah. All right, we are going to stop the recording. I just want to thank everybody for joining us tonight, and anybody watching the recording, if you are ready to get started or you just have more questions, go back to the person that, sent you this, or, your friend that loved you enough to share this information with you. So we're going to stop the recording, then I can answer any questions.